Once again, thanks for joining us here on the Roundtable on this Sunday afternoon. We are giving you these factoids at home as we continue to talk about the battle that is cancer. The risk of developing all invasive sites for females, 1 in 3, the risk of dying, 1 in 5. And we were talking about those factors and prevention, an ounce of prevention, as they say. You know how the saying goes, cancer prevention study CPS 3. Happening this week in Defiance, and we're going to give you the specifics of the sites, the where, when, who, how, all that jazz. Coming up, Josie LaRoe, also Jessica West and Jan Tipton joining us this morning talking about this study. And there was a CPS 3, there was a CPS 2, there was a CPS 1, these cancer prevention studies. And as we showed you a graphic, we go to our Apple TV app and show you that you see what these studies have come out with, what these studies have proven. And as we look at just simple facts of life, the link between cigarette smoking and lung cancer, there is a link there. The cancer prevention study found that link. Lung cancer death rates are higher among non-smoking spouses of smokers. Physical activity lowers various cancers, including breast, colon, and prostate cancer. Longer time spent sitting in association with a higher risk of premature death. People with type 2 diabetes. The list goes on and on. These studies are obviously having results.
Absolutely.
Go ahead and step in.
Oh, absolutely. You know, my favorite is when we go in, Josie and I have done several tandem presentations to high school students to tell them, talk to your parents and note yourself. Being physically active, getting up and moving, making the right food choices, and choosing not to smoke are going to give you a 70% chance of reducing your risk of getting cancer. I mean, if I knew I had a 70% chance of winning the lottery just by picking this ticket, I'm going to go out and buy it.
Yeah.
And in the reverse, if I know I can get active, eat right, and avoid smoking, and I'm going to reduce my risk of cancer, then I'm going to do everything I can to avoid the battle that my grandma, my great aunt, my great uncle, and the millions of our volunteers and other people have had to suffer.
I know we sit on the desk, the news desk in the studio next door, and we'll sit there each morning and we hear these new studies that come out on Good Morning America, and they'll say, you know, get proper sleep, and we're like, don't get that. Don't include caffeine in your diet. Don't have that. And you know, you just go down the list, and it's like you have these vices. But as we go forward with this CPS study number 3, and let's talk a little bit about University of Toledo in April did another one of these. People are coming in, they're getting screened, and they are playing a role in how effective these are.
Absolutely. We had 2 sites in April at our UT main campus and health science campus, and we did have a wonderful response from the community. People came out, and primarily I think many of them came because they knew of someone with cancer, or you know, they had a family member with cancer. So there was a personal interest, and you know, they're just trying to do whatever they can to help us learn more, to help our children, our grandchildren, know how we can hopefully avoid cancer.
Now, who gets involved with this thing? Are you looking for people with or without cancer?
We're looking for people without cancer. Obviously, this study, we're looking to figure out what causes cancer and how we're successfully preventing it. So we need people who have not been diagnosed, with the exception of if they've been diagnosed with a basal or a squamous cell skin cancer, they can still participate. Okay. But we're looking for non-cancer survivors to tell us about their lifestyle, about their environment, about their medical history, so that we can help figure out, again, how our children, how our grandchildren can avoid cancer.
This is not a quick study. This lasts a while.
It's a long-term commitment, and but I think that's somewhat misleading because people think, oh, it's going to be hours of work, and it's not. The study itself is a short enrollment process. We are asking people to drive to Defiance to be a part of it. Yeah. But as far as the follow-up studies, we're looking at 20 years or more that we'll be doing surveys, but it's every 3 years, and it's about a 10-minute survey. So it's not a lot of time, but it's a lot of impact.
And you're asking people to go online prior to showing up to Defiance, correct, and getting enrolled?
Right. The perk of this study is they can go to defiancecps3.org and pick a 30-minute appointment time slot on either October 3rd or 4th, whatever fits in best with their schedule. And then we send them their initial survey that they can do in the convenience of their home online. They can save it if they get to a stopping point and come back to it, and it's going to remember everything. And that's all of their pre-work. On the day of enrollment, we'll walk them through the process. We are going to take a little bit of blood that we'll look at later down the road if they're diagnosed with cancer to see what we can link back. But then, as Josie said, really your only follow-up after that is a survey that's going to take you 10 minutes every 3 years for the next 20 years. So not even 6 hours out of their life to impact a huge impact on future generations that could save their lives from cancer.
So we get some of these results coming out of CPS 1. CPS 2 is still ongoing, as I understand.
It is. And in fact, some of the results of CPS 2 were outstanding enough. They started a cohort just on nutrition and physical activity because they realized that, wow, we're seeing some trends here. You know, the people who are exercising and hitting those allotted amounts that we're all told we're supposed to do, you know, their risk of cancer has been reduced. And the people who are eating fruits and vegetables and broccoli, you know, we all know that broccoli is good for us, and that's part of
Try
CPS
to drive
2.
that home to the kids
I
all.
know, that's right.
I'll put a little cheese on it. We'll get through it together.
We won't discuss the cheese.
Exactly. It's the best kind, I promise. As we look at the people who are coming in, as you said, they're given a little bit of blood. You're taking diagnostics as well while they're there?
No, we're just asking for, we have trained phlebotomists come in and they're just going to take a little bit of their blood, and that's the end of their appointment on the day of. We're just going to greet them, confirm that they're between the age range, which is 30 to 65, and that they've not had cancer, and they're just willing to commit to filling out the follow-up surveys.
Why is that age range important?
Well, we need to follow them for 20 years. So obviously on the high end, we're looking at people that are going to be around long enough to fill out the surveys. And on the young end, we want people that are generally set in their lifestyle. You know, in the 30s, most people, they're married, they're settled down, they're established in their careers, and we're going to be able to follow them without having to track them through multiple colleges, multiple careers. So these are people that we know we're going to be able to get that 20-year commitment out of to really make it a valid study and to get good results.
Is this same thing happening all across the country?
It is. We are hoping by the end of this year, so by December 31st, that we will have 300,000 people enrolled. And we have about 50,000 to go. So in the next couple of months, we really need to get people to come out.
And those results start coming in almost immediately, right?
Actually, I'm a participant in the study as well, and I've started to get newsletters with just some practical information, and certainly they can't make any huge declarations at this point, but just some little information that they're starting to, you know, healthy things and trying to reach out.
So let me ask you, if you get involved in this and you're being a participant in this, are they, I guess, scanning you, or are they using the information you give them in order to make judgment calls and learn from your lifestyle?
Well, they ask several questions about lifestyle factors, exercise, you know, sun exposure, lots of things. So
But are you getting a report card back?
No, and that's very difficult. And that was a question that a lot of participants ask. It's very difficult to get an individualized report back because we need to look at huge cohorts of patients to be able to draw conclusions. So as much as you would like to have maybe more information, it's still for the benefit of the whole community and of the country.
Yeah, and I think during our break you brought up something very poignant in the fact that you said, I put that question, it was broad in scope, but I put that question out there about everybody being affected by cancer in some way, shape, or form during a time of their life, and you said, well, maybe that's because people are living longer. Basically, we're essentially healthier by and large, we're just, longevity is there, so cancer has a longer window.
Yeah, I mean, really, when I think back to my great-grandparents, you know, they were dying in their 70s, 80s. They weren't living into now. We're seeing people living into their late 80s, early 90s, even up into the 100s. And while we're living longer, it may not necessarily be healthier. So yeah, we're giving cancer a little bit longer of a chance to catch up with us. So that's, you know, that's unfortunate that we're seeing those numbers, but unfortunately we're also now more aware of it.
Yeah, so let's get people in the door, Defiance, Thursday or Friday. Let's talk to them. They come, they show up at the college, and what happens?
They show up at the college, again, they're going to be greeted, we're going to walk them through, make sure that they're eligible, and then we're going to have them fill out a brief follow-up survey. We got to confirm that the questions they answered before are staying the same for quality assurance. After that, we're just going to walk them through the process one more time with our survey, make sure we're coded properly. Our phlebotomists are going to take some blood, and then they're out the door, and they aren't going to hear from us for about 2 or 3 years with a 10-minute follow-up survey.
They do also get a waist circumference.
Yes.
And that's something that we're looking at as a risk for you know, how big your waist is. So it's also a stimulus to, you know, think about, you know, your waist.
And it is in centimeters, so unless anyone's got their metric calculator out, no one's going to know your waist measurement. We do want to make that clear because people are, oh, you're going to display my waist measurement. Nope, centimeters, extremely confidential.
You're looking at the specifics there. The CPS 3 at Defiance College in the Sarah Campus Center, 701 North Clinton Street, Thursday, October 3rd 3:30 until 8, and then Friday, October 4th, from 9 until 1:30. This does render results, folks, when you do get involved, and it is helpful going forward. Thank you so much to Josie, Jessica, and Jan, the four Jeffs on the four J's on the table, including me. We appreciate it. Thank you so much.
Thank you.
We'll be back right after this.